Welcome to Wellness Woodbridge. I'm your host, Ann Mazza of Vito Mazza Salon and Spa, and today I am here with Dr. Dhimant Balar. He is a sports medicine doctor, and he's going to be sharing with us some of the great things that you can do if you go to a sports medicine doctor, sometimes to even avoid surgical procedures, and what sports medicine is really all about. So hi, doctor. Thank you so much for being with us.
Good. Thank you. Thank you for having me. Appreciate it.
So you're affiliated with Raritan Bay Medical Center.
That's correct.
And you currently have an office in Freehold, but you have a satellite office that will be right here in Woodbridge.
That's correct. My primary base is out of Freehold, but I will be starting in Island, right next to the Jose Tejas in early May.
Wonderful. Yeah. Great.
Excited about it.
So explain to us, sports medicine, what really is it?
Well, the field of sports medicine is a branch of medicine that specializes not only in athletes and athletic injuries, but it focuses on anyone that's active. It's a comprehensive treatment for any active individual. There is a misconception that if I don't have a sports-related injury, I can't go see a sports medicine doctor, and that's false. Sports medicine physicians are trained in treating any active individual, and it's more of a comprehensive, non-surgical approach to treating both these injuries. It focuses not only on the injury itself, but helps educate. What we try and do, we try to help educate patients into why they develop these injuries and focus on prevention methods.
So any type of movement, like you could be moving just, like you said earlier, just putting a hammer and a nail, it could be anything while you get injured, like a movement type injury.
Right. The analogy I give to patients to explain shoulder injuries, for example, baseball pitchers are notorious for playing for years and years. They put a lot of wear and tear on their shoulder. So they come into the office or may come into the office with shoulder pain. I may see the same clinical presentation in someone who's a carpenter who's been putting up sheetrock for 25 years. So when you look at the pathophysiological or of the injury, the basis of the injury and the mechanisms of injury, even though they were obtained or they developed in different roles or different specialties, the injury, when you look at it, it's basically the same.
So kind of almost like an overuse to any type of a muscle.
Sure.
Could come to you for some type of a relief.
Absolutely, that's one aspect of injury, right? And
you'll treat the injury with conventional medicine, but also you do some integrative therapies as well.
Yes, I've recently brought in an acupuncturist and medical massage therapist, which I think complement what we do at our locations very well. The answer to injuries is not always medication. For me, all my patients leave with the understanding of what their injury is and then a fully individualized plan to help develop in focus so they don't get these injuries again. Now, sometimes we do have to treat these injuries with medication injections, and sometimes we can avoid them doing other integrative approaches such as acupuncture and medical massage therapy, which is much less invasive.
Wonderful. So you treat clients of all ages.
That's true.
And basically, if I come to you for a therapy, let's say, maybe I have a shoulder injury or a leg injury, will you hold on to a client for a certain amount of time? Would it be like 6 months until you see if something else can be done, or how does that usually work?
Well, luckily, the patients that come in, we can manage and get them. We can manage them acutely and get them on a good rehab program right away. The old days of I hurt my back, I need to stay in bed for 2-3 weeks, and then I can gradually get back to activity is long and gone. The key to managing injuries now is getting back to mobility. And what we do is once I see the injury, we evaluate them in the office, and then we start them on a progressive approach to getting them back where they want to be. Now, usually they do well with, in terms of management, it's the evaluation, and they get on either a home exercise program or I may prescribe physical therapy. And depending on the injury, you may start seeing results very soon. For some people, it may be days. Okay, for other people it may be weeks. And it's the management of their progress and following them which will really determine what else we need to do, i.e. do they need further imaging such as MRIs or maybe more comprehensive treatment. But to answer your question, usually patients, they start seeing results with the plan within a few weeks.
That's great. So really, like physical therapy, I mean, you do see a lot of inflammation, I think, in clients. So anything that's overused can be like inflamed, right? So with the use of the physical therapy, maybe with the acupuncture, maybe you're reducing that inflammation to kind of lessen the pain?
That's correct. I mean, the basis of all injury is inflammation. And whether you talk about sports-related injuries or if you talk about medical illnesses such as diabetes and heart disease. So the key approach has been, how do we reduce inflammation? Now, when we talk about injuries, the old conception, or not old conception, but the conception of icing immediately. Why do we do that? Well, the process behind icing immediately is to decrease inflammation. Okay, so with swelling comes expansion of tissue and compression of nerves, which lead to pain. So the acute management of injuries include ice. However, the body, as we are now finding out, and we're slowly, with research and through our conventional approaches, we're finding out our body has its real good ability to heal itself. And the only way it can do it is by promoting blood supply to the area. If there's an area of injury that does not have blood, it heals much more slowly. That's why patients who have tendinitis, they heal much more slowly, because tendons don't have a lot of blood supply. So things like acupuncture, medical massage, manual therapy can get into these areas and actually promote blood supply to the area to actually improve the healing process. When we take anti-inflammatories, we're actually doing something that's 180 degrees opposite of that. Right. We're actually decreasing inflammation. So every injury has a different approach to management, but in terms of the chronic injuries that you're talking about, overuse injuries, it's usually the tendons that become inflamed, and we actually want to promote blood supply to the area to actually promote healing in the long term more quickly.
Yeah, it's excellent. I mean, you can imagine, you know, I know that we said sports medicine could be used for anybody, but also like an athlete that is so, you know, used to doing a certain function, you know, whether it be swimming or running, and it's really part of their life. It's part of their lifestyle. So the fact that you can help them get back to that, I think is a huge benefit.
Sure, and I think with athletes and any individual that comes in with a repetitive type motion pain, it's understanding why they got it. Why did they get the injury? Because it's one thing to see the injury, evaluate, and treat it, but if there's a repetitive mechanism, for example, computers at work, people coming in with neck pain, if we don't fix the underlying issue, then the pain will come back. So we try hard to educate our patients and making them understand not only what their injury is, but try and analyze how they may have gotten it so they can make changes to prevent it from happening again.
It's a very large wellness issue to me, to not mask the problem, but to find out what it is that causes the problem. I even myself try not to take, you know, anti-inflammatory unless I'm like, you know, have such a beating headache or something that I just can't, you know, avoid it, because you realize that sometimes after taking it, it comes back and it's almost even worse because your body gets used to relying on that for the pain removal, and then all of a sudden it comes back and it hurts even worse.
Even more. Right. And the thing with anti-inflammatories, as we were discussing previously, even all these medications have side effects. And I'm not discouraging the use of anti-inflammatories, but at the same time, I don't want to present the picture that anything over the counter is very benign. Things like Advil, aspirin, Tylenol, Aleve, all of these drugs, even though they're over the counter, if taken in, you know, a lot of consumption, if you will, can lead to other problems such as stomach issues and also interactions with other medications that you may or may not be taking.
I think we're realizing, you know, that all these integrative therapies could be such a great preventative method, you know, just helping with our overall wellness, and then, you know, just realizing that we don't, you know, not listen to our doctors, but there can be other alternatives besides, I went to the doctor, he prescribed this, and now I'm going to go ahead and take this. Right. I think what you're prescribing is also, you know, preventative methods. It's a way of looking at the problem differently and trying other options, which I think is great.
Yeah, that's our focus, and that's our philosophy. It's really education. Education and means of prevention. So patients have to take more of an active role in terms of managing their injuries. Not everything is a quick fix.
Well, sure. I mean, pain management, when you think about it, it's just great that there are other ways to deal with it without just total medication, and realizing that, you know, there are other options out there, which I think is great. It's not just sports medicine, it's for everyone to utilize. If you're feeling pain, it's coming from somewhere. So
exactly.
Let's find out why. Let's find out why we're in pain and then treat the problem from there. So that's a great, it's a great option for clients, I think, and for your patients.
No, it's great. I enjoy doing it, and it's all about education.
Well, we're excited to have you in Woodbridge.
Thank you.
This is great, and I hope that, you know, people do find you, Dr. Balar, to come on in if they are having some pain issues. It was wonderful to talk to you about the fact that, you know, it doesn't have to be sports related, and we can go for, you know, whatever our injuries could be prior to even surgical procedures, which, you know, surgery also has its risks. So
right.
If that can be avoidable, I think it's a great option for your patients.
Oh, great. Look forward to being here. I look forward to helping the community in any which way I can.
Thank you so much. We're so happy to have you.
Thank you for having me. Appreciate it.
Well, thank you for joining us today on Wellness Woodbridge. This was a great opportunity to talk to Dr. Balar about pain management, and we look forward to having you again. Thanks so much.